Now comes the pathophysiology. So there is malfunction of eustachian tube. This is the most important thing in cause that is responsible for causing otitis media. Okay, so here, because of malfunction of eustachian tube, when tube is not functioning properly, it prevents the normal drainage of fluid from the middle ear. Okay, it normally drains the fluid from, as I explained in the anatomy, there is opening of eustachian tube in the which forms the anterior wall of the middle ear. So this by this opening, from this opening, there is a drainage. Okay, so if it doesn't work properly, if there is obstruction of these eustachian tube, so it causes the buildup of fluid behind eardrum. Okay, the fluid starts accumulating there. Okay, so if it is not working, then normal drainage of fluid from middle ear is prevented, and it causes buildup of fluid. When this fluid cannot drain, it allows for the growth of bacteria and viruses in the ear. Okay, so then there is growth of bacteria and viruses in the ear, which leads to the acute otitis media. Okay, now there are some pathological stages which are important. First one is catchal stage. So in the catchal stage, it is characterized by the occlusion of eustachian tube and congestion of middle ear. Then there is stage of exudation, where exudate collects in the middle ear. Okay, then there is stage of suppuration, where the exudate which gets collected in the middle ear, it starts starts to become purulent. Okay, and either the otitis media starts either the complaint starts to resolve and leads towards healing, or it starts to get complicated. Okay, and leading to the various complications which we will discuss later. Okay. Then classification. There are mainly four types of otitis media: acute otitis media with effusion, chronic suppurative otitis media, and adhesive otitis media. Right? Now, what are the clinical features? So, most important thing in the otitis media is otalgia and otorrhea. Now, what is otalgia? That is ear pain, and otorrhea, that is ear discharge. Okay, this happens when the eardrum becomes perforated. There is fever, reduced hearing, then tenderness on touch of skin above ear, irritability, diarrhea in infant, and as I said, it is preceded by URTI. So there are symptoms of upper respiratory tract infections like cough or nasal discharge. Now, what is the diagnosis? How you can diagnose your otitis media? First, you take history. Okay, so you'll find the signs and symptoms. As I explained earlier, these signs and symptoms are present in a patient of otitis media, so in history you'll get it. After that, there is examination is done by pneumatic otoscope. Okay, which is called as pneumatic otoscopy. And here in the eardrum, you'll find that there are changes in the eardrum. Normally the color of eardrum is pale gray. Okay, and if you see it as a dark pink or light red, then it suggests acute otitis media. And this eardrum is also bulging. Okay, as fluid gets collected now here in middle ear cavity, so the tympanic membrane, which forms the lateral wall, it bulges. Okay, so there's bulging in acute otitis media. There is a difference this is very important difference in acute otitis media and otitis media with effusion. Okay, in acute otitis media there is bulging, and in otitis media with effusion there is retraction of the eardrum. Then there is reduced motility, and there may be perforation of the eardrum. Next comes the investigations. The investigations are not necessary in otitis media as the diagnosis is mainly clinical. Okay, so but it is if if the condition becomes severe, in that case we can go for full blood count, which shows leukocytosis as there is infection, obviously. Then culture and sensitivity test, which shows which antibiotic we can use to treat it. Okay, then we can do CT or MRI if there are complications in the brain, and tympanometry. Okay, then differential diagnosis. So in the differential diagnosis, there is acute otitis externa, hepatic lesions of the external ear, all causes of pain in the ear, and crying child. Now this thing is important. Crying child can be differentiated from the otitis media by looking into the eardrum. In the otitis media, the eardrum is red, as I said now, it is light red or pink. And in the crying child, it is also red. Okay, but it is not edematous in crying child. Okay, while here there is bulging, edema, light red, etc., etc. Okay, so the in the crying child it is not edematous, but it is red only. And another thing is light reflex. In crying child, light reflex is present. Now what is light reflex? When you examine via otoscope, you can see that in the otitis media, as fluid gets collected behind the eardrum, so light reflex is absent. Light reflex is absent in the otitis media. But in the crying child, as there is no fluid behind the eardrum, as there is no infection, no fluid buildup, the light reflex is present. Okay. The next comes the treatment. Okay. Treatment, there are basically three options: systemic, local, and surgical. Now, in the systemic, we usually recommend antibiotics, that is amoxicillin, az- azithromycin, or clarithromycin, and cephalosporins, that is cefdinine, cefuroxime. Okay, in penicillin resistant patient, penicillin allergic patients, we can use this azithro and clarithrome. If the patient doesn't get clear, then we can also use amoxiclave. Okay, and antihistamines and decongestants are not very much useful in these cases. And next is local. So local, we mainly use eardrops. Okay, eardrops, we can use it before perforation and after perforation. Before perforation it is not very much useful, but it may be helpful in cases of pain. It may reduce pain. Okay, and we can here prescribe glycerine carbolic eardrops or warm oil. Okay, after perforation it is very useful because it controls the bacteria and it destroys the bacteria, and etc., etc. So antibiotic drop after perforation. Then next is in the local only, oral toilet, which means the removal or clearance of the middle ear from its discharges or debris, or any like in any fluid. Okay, so and also water should be prevented from entering the ear. So it is oral toilet. Then surgical. So in surgical, mainly meningotomy with tube or grommet placement. Meningotomy is nothing but incision is made in the eardrum and the fluid is removed uh, from the middle ear so that it gets cleared. Then tube is placed, which is also called as grommet placement, and this tube, it is also known as tympanostomy tube. Okay, so this tube is placed in the eardrum, very small tube. And what this tube does, it will remove the fluid which again starts building in the middle ear, so that again it will prevent the recurrence of the infection. So that's how it will work. Okay, so myringotomy with tube placement. Then next is complications. So as I said earlier, that posterior wall is formed by the mastoid hair cells and mastoid antrum. So the infection may get transmitted to the mastoid hair cells, and it will lead to the acute infection of mastoid hair cells, and it may lead to mastoid abscess. Then there may be, if it transmit upward to the brain, it will cause meningitis or brain abscess or epidural abscess. It may cause septicemia and infection of labyrinth if it transmit to the inner ear, as inner ear is also known as labyrinth. Okay, so this is how it works. Like, I explained otitis media. If you have any doubt, you can ask me in the comment section. I hope you understand. Thank you.